Hello everyone, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today.
In this episode, I will discuss the important updates in the field of congestive heart failure and transplantation from 2023. In the field of heart failure in 2023, it was a year of mixed signals and evolving strategies. 2023 wasn't quite as explosive for heart failure research as some previous years, but it still delivered a fair share of intriguing findings and policy changes. Here's a quick rundown of the key developments. These are a few important clinical trials. 1. STEP-HFpEF. This study tested the GLP-1 agonist semaglutide in heart failure with preserved ejection fraction, HFpEF, and showed promising results, with improvements in symptoms, inflammation, and physical function. 2. CASTLE-HTx. This trial found that catheter ablation for atrial fibrillation, AF, improved outcomes in advanced heart failure patients even if they were being considered for heart transplant or left ventricular assist device, LVAD, implantation. 3. HEART-FID. This large trial on intravenous iron supplementation in heart failure was somewhat disappointing, failing to meet its primary endpoint despite some positive signals. Though iron repletion with ferric carboxymaltose was associated with numerically fewer deaths and HF hospitalizations and greater gains in the 6-minute walk test, the trial failed to meet its primary endpoint with a composite of these individual endpoints. For DAPA-MI, this study of the SGLT2 inhibitor dapagliflozin in acute myocardial infarction patients with impaired LV function or Q-wave-MI had mixed results, improving cardiometabolic outcomes but not reaching its primary endpoint of reducing CV deaths and heart failure hospitalizations. These are a few policy and guidelines updates. 1. European Society of Cardiology Cardiomyopathy Guidelines. These comprehensive guidelines covered diagnosis, management, imaging, and genetic testing for various types of cardiomyopathy. 2. The Inflation Reduction Act. This legislation includes provisions for Medicare drug price negotiation, potentially impacting several key heart failure medications, mainly quadruple cardiomyopathy medications. 3. FDA approvals. 2 medications, dapagliflozin and sotagliflozin, received FDA approvals this year, offering hope for people with heart failure of any severity. These are a few other highlights from 2023 in the field of heart failure and transplantation. Story of the second pig donor. The world's second living patient with end-stage heart failure received a genetically modified pig heart transplant at the University of Maryland but sadly died after 6 weeks due to transplant rejection. The ARES-HCM3 trial showed that dropping aspirin therapy can reduce strokes, bleeds, and hospital stays in left ventricular assist device patients. This may change the management of LVAD patients. The PUSH AHF trial explored a natriuresis-guided approach to diuretic therapy in heart failure, but its impact on clinical outcomes was unclear. The QUEST trial from China suggested that traditional Chinese medicine, Qiliqi-Yangcen, which is made from 11 different plants, may be beneficial in heart failure with reduced ejection fraction. Looking ahead, the following are some important news updates. The declining interest in advanced heart failure and transplant cardiology fellowships is a major concern, and strategies are needed to make the subspecialty more appealing. The increasing overlap between heart failure and other areas of cardiology, like structural heart disease interventions, may require new training pathways for specialists. The growing understanding of the continuum between risk factors, preventive measures, and heart failure, particularly in HFpEF, is leading to new treatment approaches like GLP-1 agonists.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.